This presentation will be about pharmacogenetic DNA testing, but before we get into the gist of the matter, I wanted to present some past scientific data that demonstrates the potential dangers of drugs misuse. And one of the European studies looked at emergency admissions in hospital, and what they found out that nearly half of all of the admissions to the emergency were due to medication toxic side effects, and approximately one-third of all emergency admissions were specifically due to chemotherapy drugs. This will be important later on when we discuss the need for pharmacogenetic testing for cancer patients. In a more broader context, one landmark study looked at hospital admissions over a span of multiple decades, and what they found out that approximately 7% of all hospital admissions in the United States were as a result of adverse reactions to medications, and about 0.3% of all deaths inside hospitals were due to medications use. While this might not sound like a large number, this actually equates to approximately 100,000 patients dying per year in hospitals due to inappropriate drug use. And this puts drug use related deaths easily in the top 10 leading causes of death in the United States. So this summarizes how potentially dangerous medications can be if they are not used correctly. The reason why we observe such poor outcomes with medication use is due to the fact that most medications have only about 50% efficacy, which basically means it's a total trial and error whether a given medication will work effectively on a patient or not. And now we could actually be assessing the genetics, personal genetics, to determine how each individual person metabolizes medications in a bid to increase the medication efficacy. This is what we refer to as pharmacogenetics, which I will abbreviate as PGX throughout this presentation. Therefore, the primary purpose of pharmacogenetic DNA testing is to ensure, first and foremost, that a given drug or a medication is used effectively for a given patient. This is what we refer to as personalized medicine. Drug effectiveness, in turn, is achieved in two ways. First and foremost, it's by determining, ideally, what is the best drug dose that should be used for a patient. And another aspect is to determine whether certain medications could be toxic to a patient according to patient's personal genetics, even prior to medication being used. But the vast majority of pharmacogenetic information will provide information on drug dosing. And there are a number of aspects that need to be considered here, but the major one is learning how a drug or medication is actually metabolized by a patient. Other information that we can learn that will determine ideal dosing of the drug is how a drug is actually being transported inside the body, as well its mode of action, or what type of receptors the drug might be targeting. But as already mentioned, metabolism of the drug will be one of the most important information that can be gained from pharmacogenetic DNA testing. So let's spend a little bit more time here. Currently, when drugs or medications are provided to any individual, it's always assumed that that person is what is referred to as a normal metabolizer. However, we know that is not the case, and we've known that for a long time. It's just that until now, we were not able to really assess the individualized differences in person's drug metabolism. So we can deviate from normal metabolism, any person could, and some examples are people who are rapid metabolizers, which means they will break down drugs faster than expected from a normal metabolizer, and even ultra rapid metabolizers. These people will be processing medications that they are taking very rapidly, which means the medication might not actually serve its proper utility. On the opposite spectrum, you can also have intermediate metabolizers that are below what would be expected from normal metabolizer of a drug, and then we can also have poor metabolizers. So people who are not actually breaking down the drug, and in that case, in that situation, once again, the drug might not be at all active, or it might lead to toxic buildup inside the body. So this is how metabolism can actually also inform about drug toxicity as well. So dosing of the drug is actually very important. As a consequence, pharmacogenetic testing offers many benefits. Number one, it increases the effectiveness of medication use for patients. Number two, it can reduce the likelihood of adverse reactions associated with medication use. Number three, it can also mitigate unwanted drug-drug interactions. This is actually a very important benefit that not necessarily every pharmacogenetic test can offer, but for those who use multiple medications, this can be very valuable information. Next, it also increases patient compliance with medication use precisely because of the reduction of negative outcomes linked to medication use. And finally, it reduces the overall costs, healthcare costs, due to more efficient use of medications. So, who can benefit from pharmacogenetic testing? Who is most likely to see rewards when doing such DNA test? Right now, what you are seeing is how different medical specialties are represented in pharmacogenetic tests. So the higher the bar you see, the more medications given medical specialty already has linked to genetics. So what you can see, psychiatry or mental health disorders have the most medications associated with pharmacogenetics, and therefore such group of people, patients, are likely to benefit the most by considering pharmacogenetic tests because they are most likely to encounter a medication that could be personalized to their own genetics. The second largest group is cancer-related medications, and the third one is cardiovascular. But if you find yourself in any of these groups, it might be worthwhile to consider looking whether the medications you are taking are already associated with personalized genetic information in determining how that medication should be used for your benefit. And this is just an average representation from a specific test that Merogenomics distributes, but it gives you a ballpark of what can be expected. Another way of looking at this information is to look at what kind of conditions are actually being treated with medications currently that are already linked to pharmacogenetic information. So in other words, if you find yourself affected by any of these conditions, once again, you might want to consider looking whether the medications you are taking are linked to genetic information, which could help a given person determine if that medication is used most effectively or not. In this final slide, I will mention the top considerations as to when pharmacogenetic testing should always be considered. These tests are actually not very expensive and they might, might provide tremendous benefits. So number one, if you are a cancer patient, you should always consider using pharmacogenetic test if the medication that is being prescribed to you is indeed linked to personal genetic information. And the reason why is because cancer is quite a debilitating disorder and it can be very costly to a patient if the patient is treated with wrong medication. So if you can learn that information up front and save yourself that problem and simply go to more appropriate medication, this is a tremendous benefit. So all cancer patients should always consider pharmacogenetic testing. Likewise, it's the individuals that are suffering with mental health disorders. And the reason for that is because this group, apart from me already mentioning that they have the largest repertoire of medications that are already linked to pharmacogenetic information, this group of patients is also most likely to require trial and error and therefore change of medication. So it's estimated that approximately 1 in 5 of every mental health patients will require medication change. And therefore pharmacogenetic could help reduce this trial and error. But besides conditions, there are other reasons why pharmacogenetic testing should always be considered. So if you fall into any of these categories, it's something to think about. Number two is if you are taking multiple medications. As a matter of fact, having multiple medications in your regimen is the largest predictive factor of experiencing toxic side effects from medications. So pharmacogenetic testing could help alleviate that. Next is if you have dangerous comorbidities. What I mean by that is health problems that we already know can be specifically linked to increasing the likelihood of experiencing, once again, adverse drug reactions. Next is old age, and that's for the reason that most of the time, the older the person is, the more likely they're going to be encountering health problems, and also the more likely they are to require more than one medication use. So once again, old age is one of the more common predictive factors of potential problems with medication use. Next is if you are going to be undergoing surgery. This pharmacogenetic testing can really aid in proper drug selection in terms of both before the surgery as well as post-surgery. Finally, anytime you are prescribed a medication that is known to potentially have really dangerous side effects or medication that frequently produce side effects, you might then consider using pharmacogenetic testing. And the final reason is potentially quite controversial one, and that is a person's gender. Some studies indicate that women are more likely to suffer from drug toxic side effects than men. And if you already fall into any of the above categories already, and you're a woman on top of that, that might also be additional incentive for you to consider using pharmacogenetic DNA testing prior to your medication selection. So I hope this helps you understand what pharmacogenetic testing is all about, who can benefit from it, and when it should be used. I wish you all the best and happy DNA sequencing.